Hi everyone, and welcome back to our Tea Time Chat. I remain Sinat, your favorite informative prostate specialist urology nurse practitioner. In our last episode, we discussed what could cause your PSA to be raised, and we described this using the traffic light system. We also discussed the ladder of investigations and went further to talk about the fair bedded finger of the bum test. That's the digital rectal examination. We mentioned the high-tech imaging, which is the MRI, that can visualize the entire prostate. So if you are here to watch or catch up on the previous episode, go to the YouTube channel and watch the full video. And if you are a man of black background and heritage, and you are 45 years and above, you're watching me at the moment and you are yet to get your PSA blood test done, could you please interact in the comment section? What is stopping you from doing this? We want to know why you don't want to do the test, and we would be answering questions and your messages and addressing all the frequently asked questions as well. So please, if you are watching me and you are a man from a black background and heritage and you're yet to do your blood test, please go to the nearest hospital and get your PSA blood test done. It's a 10 minutes blood test and it saves you for life. So please get your blood test done. So we are going to be talking about the third cause of raised PSA. And what is this? We mentioned that an enlarged prostate could cause your PSA to be raised. And we mentioned also that inflammation, that is infection, can cause your PSA to be raised. Like what is described there on the traffic light system that helps to describe the reason for raised PSA. So the third cause of increased PSA that we're going to be discussing on this episode today is prostate cancer. Prostate cancer, prostate cancer. I know when people hear the word prostate cancer, they start to fear and they start to get anxious. But you don't need to be anxious. Papa Shidi, diagnosis of prostate cancer is not a death sentence. Imagine, say, there is a smoke alarm blowing up in your kitchen, and we don't know if this alarm was caused due to burnt roasted corn or a small grease fire or a real fire outbreak until we call out the fire services to help out with the fire outbreak. The fire services will then find out the cause of this fire, as well as help prevent further spread of the fire by tackling the cause of the fire using their resources and services to stop the fire. That is what we are going to do when we know you have a diagnosis of prostate cancer. So just think about it in that way, and think about prostate cancer as a fire, and think about the healthcare professional as the firefighters who are helping to put an end to the fire outbreak, and they are going to help prevent the prostate cancer from spreading to other organs and from spreading to your bones. So let's talk. What is cancer? Let's start from the beginning. Our bodies are built with trillions of tiny bricks, and these bricks are called cells. We medical people call them cells, but they're just like building up bricks that makes up building a house. Normally, your body is a well-run factory. When an old brick gets weak or breaks, the body replaces it with a new, healthy one. Everything is in order when that's up. But cancer is like a rebellious worker in the factory. Some cells stop following the rules and start multiplying like crazy. That is how the cancer cells behave. They start to multiply uncontrollably and fast. So the rebellious cancer cells, they don't want to wait for their turn. They just want to start taking over spaces that are meant for healthy tissues. And when this wahala starts inside the man's prostate, that is what we call prostate cancer. don't panic just yet. Here is the thing. Most prostate cancers move like a snail, very, very slow. Some won't even disturb you or shorten your life at all, especially if we catch this prostate cancer early and keep an eye on it. And this is why we are advocating for people to get their PSA blood test done early enough so we can catch the cancer early and keep an eye on it, so that we can check for the trend and check that the PSA level does not grow and increase outrageously. But there is a but. Some types are very aggressive. They move fast and start to travel from the prostate to your pelvic area and your lymph nodes, or even your bones. And once the cancer gets to the bones, you start having serious pain. We don't want it to get to that advanced stage. The secret to winning in this fight is early detection. A lot of men say, but I feel fine. Nothing is hurting me. Listen, prostate cancer is a silent visitor. You usually only feel pain or wee-wee problems if the cancer is going right next to the pipe that carries wee out of the body. But most times, the cancer starts in the outer corners of the prostate, far from the pipe, so you don't feel anything. And that's why the PSA blood test helps us to detect if there is anything wrong with the prostate. So that's why we use the PSA blood test to actually detect if there is anything wrong. Think of the PSA like a speedometer. And we expect it to go up very slowly as your age increases. Like it climbs gently. But if we see your PSA gallop or jump suddenly in 1 year, that's a red flag. We care more about how fast it is rising than the actual number itself. There is a graph on the screen that describes what the normal PSA level growth should be and what an abnormal PSA level growth that gives an healthcare professional concerns. A normal increase in PSA level is slow and steady, and it climbs gradually, amounting to about 2.9% per year. The red flag is a sudden jump of more than 0.75 increase in your PSA level in a single year, or a 0.35 increase if your overall level is still very low. This then triggers us to start further investigations. As healthcare providers, we are often more concerned about the speed of the increase than the number itself. So let's look at this ladder, the ladder of investigation that is just showing on my screen here. This ladder that is showing on the screen here. So when there is a sudden climb in the PSA level, we then gradually move to the next stage on this ladder of investigation. And what is the next stage on this ladder above here is the finger test. That is the digital rectal examination. The doctor uses a gloved finger to feel the prostate, and we are checking to feel if it feels hard or lumpy like a stone. So this picture here shows how a digital rectal examination is performed. And this is done by trained healthcare professionals. After the digital rectal examination, just like on the ladder of investigation, is the MRI scan. That is a scan that visualizes the entire prostate. This is like taking a high definition photo of the prostate. Imagine the prostate is like a sponge. Look at this makeup sponge in my hand. That is how the prostate looks like. So the prostate is like a sponge. The MRI helps us to see exactly what part of the sponge looks suspicious. So imagine if you are doing a digital rectal examination, you won't be able to feel the top. You can only feel some part of the bottom here, but maybe some part at the side as well, but you can't feel the entire prostate. And that's why we recommend the MRI scan, which visualizes the entire prostate. So the MRI helps us to see exactly what part of the prostate looks suspicious and concerning. And look at this sponge here. So this is what your prostate looks like. Usually the outer edges, that's the peripheral zone, is where we can feel and touch with the finger. However, some cancers grow on the upper part of the prostate here, where the fingers cannot get there to examine. So that is why the MRI is the best image to visualize the entire prostate and know exactly where the problem is. The MRI image of the prostate will guide us to know exactly where is the concerning part while taking biopsy from the prostate. So we do biopsy by taking some cells and tissues from the prostate. This isn't surgery. We just use a small needle to take tiny samples, usually about 12 to 15 samples from the prostate through the skin behind the scrotum. Normally, we numb this area so you don't feel the pain. We then take this sample to the lab to see if it is truly cancer and see how stubborn these cancer cells are. Some cancer cells can be stubborn more than the other. In some cases, we request that you do a bone scan or a CT scan just to make sure the cancer hasn't tried to travel elsewhere. The goal is simple: find it, name it, and handle it before it becomes a bigger problem. So Baba Shidi, abeg, make we talk true talk. When dem take small meat from the prostate, that is the biopsy, the pathologists, that is the doctors that examine tissues under microscope, go look am under, or look the meat wey dem take from the prostate, they go look am under microscope. They go look for how scatter the cells be compared to the normal cell. The grading of prostate cancer is different. Each cancer has its own grading. So please listen now and learn. Before person can use sakamaje, can collect money from you again, say then get stage 4 cancer. So then go give the first most common pattern a number from 3 to 5. That is how the grading works. And the second most common pattern, another number. We go come add these two numbers together. For example, if the first pattern is 3 and the second pattern is 4, that is 3 plus 4 equal to 7. I know you are confused at what am I saying. I'm going to show you a chart shortly. This grading of prostate cancer is done using what we call the Gleason scale, and I will continue discussing on our next episode. Please don't forget to subscribe, comment, and engage, and send this to your friends, your brothers, your fathers, your uncles, and all your loved ones. If you are worried about any question or you have any concern you want to ask anything about, there is an email that's coming up on the screen. Just send your questions and inquiries into this email. We will be signposting you to appropriate places where you can get help. Please, if you have not done your PSA blood test and you're watching me, and you're a black man, you're a man from black background and heritage, and you have someone who has an history of ovarian cancer, breast cancer, or BRCA gene, you need to go and check your PSA. You are at higher risk. So please be proactive. It's not every time your doctor will tell you to check this thing. You yourself need to take your life into your hands. So if you have not done the blood test, go to the nearest hospital and get your PSA blood test done. Remain Sinat, your favorite prostate specialist urology nurse practitioner. See you on our next episode.